Hi, Dr. Mayberry and Gertie, back to continue our skull discussion. We're going to talk about the zygomatic, the nasals, and the palatine in this installment. So we're going to start with the zygomatic. The zygomatic arch, remember, is your cheekbone, but the posterior part of your zygomatic arch is actually part of your temporal. So we're talking about the anterior here. So anterior zygomatic is actually right here. So it's articulating with the frontal up here, okay, with the temporal right there, and with the maxilla here. Okay. It's making up part of the lateral orbit. So it's going right in here. And so this is the anterior portion of your zygomatic arch. So there aren't really a ton of landmarks that you need to know on the zygomatic bone, but you do need to be able to recognize it, especially in its articulated form. If I were to put a dot there and say identify the bone, that's the zygomatic. So there's that. Since you know that this is the orbit, it should not be difficult to side. You should realize it can't really fit in wonky like that, so it has to fit in like this. So that's the zygomatic. The nasals, you do have two nasals. You don't have to be able to side them. So the nasals, of course, sit right up here. So remember, the maxilla actually had that frontal process that comes in part of the nose as well. But the nasals are the anterior central bones there. Okay. So if you break your nose, usually you break part of your nasals. If you palpate, you can feel where the nasal ends and cartilage begins. Okay. So you just need to realize that you do have two, and they are these sort of thin-looking bones. The next bone that we're going to talk about is actually in the mouth. So the anterior inside of your mouth is actually part of the maxilla that we talked about in the last lecture. So this is that. But just posterior to the maxilla is the palatine. So the palatine is making up the posterior hard palate in there. So this is palatine right here. So if you look at this individual, you can actually see a little bit of a suture there. So these are both palatines. There are left and right palatines. We talked about the anterior nasal spine on the maxilla right here. The posterior nasal spine is actually part of the palatine. So it's in there. But this is a disarticulated palatine. So the palate is in the mouth. This horizontal plate here faces medially, and this posterior nasal spine faces posteriorly. So this would be a right. I don't really make you side them on the test, but you can easily side this. You can side the nasals as well. But just be able to recognize this as a palatine and know where the palatine is. So those are the zygomatic, nasal, and palatine. So continue to the last skull installment for the remaining bones. Okay? Ask me if you have any questions in class.